Hello and welcome back to The Left Unleashed. Today we are going to be looking at the state of social care in the UK and how we actually fix it. Because we know that social care in the UK is in an absolute state and it's in a deep and prolonged crisis. Years of austerity, privatisation and chronic underfunding have left the system fragmented, unequal and unable to meet the growing demand for care. Vulnerable people, the elderly, disabled, and those with complex health needs are being absolutely failed by a system that prioritises cost cutting and market efficiency over human dignity and social justice. The root causes of this crisis lie in the neoliberal approach to social care. And that's one that has increasingly outsourced provision to private companies, undermined public services, and exploited care workers. And we cannot allow this to continue. We have to have a fundamental shift in priorities. We need to recognise care as a universal right, bringing care provision back into public ownership. And we need to treat care workers with the respect and the pay that they damn well deserve. So let's dive in. Now, we all know there is a crisis in UK social care. First and foremost, there is chronic underfunding and austerity. Since 2010, the Tory-led governments have imposed harsh austerity measures that have severely weakened the social care system. Local authorities which are responsible for commissioning social care services have seen their budgets slashed by over 50% in real terms. This has forced councils to tighten eligibility criteria, and that means that fewer people now qualify for state-funded care. Many people who need care are either now left without support or forced to rely on unpaid care from family members and friends, and that is a damn disgrace. Now, according to the King's Fund, the gap between demand and funding for social care is continuing to grow year on year on year, with billions of pounds needed just to make sure that the system stands still. The lack of funding has also prevented necessary investment in infrastructure, training and workforce development, and this does nothing but weaken the sector's capacity. There's also privatisation and marketisation. One of the most damaging developments in UK social care has been the increasing dominance of private companies in the provision of care services. Since the 80s, successive governments have outsourced social care provision to private providers under the belief that market competition would improve efficiency and drive down costs. Instead, it's led to a race to the bottom in terms of care quality and working conditions. Now, it probably won't surprise you to know that almost 85% of care home beds in the UK are now provided by private companies, including large corporate chains owned by hedge funds and private equity firms who strip this service of billions of pounds every single year. They extract these profits by cost cutting, by reducing staffing levels, by paying workers low wages and charging high fees to self-funding residents. Meanwhile, real care providers are financially unstable, with many of them now facing bankruptcy due to the unsustainable debt levels. We also have to talk about the exploitation of care workers. Care work is one of the most undervalued and underpaid professions in the UK. Care workers, who are disproportionately women, migrants and people of colour, are often paid at near minimum wage, with many receiving no payment for travel time between clients or overnight shifts. Poor working conditions, long hours and high levels of stress have contributed to a severe recruitment retention crisis, with over 150,000 vacancies in the social care sector. And over the next 5 years, that is expected to grow to well over £300,000 unless this government starts to take things seriously. We also have to look at the unionisation of workers, because these rates among care workers are low due to the fragmented nature of the sector and the dominance of private providers who resist collective bargaining and drive out trade unions in social care. Care work remains structurally undervalued because it is seen as women's work. Work that is caring, emotional and therefore not deserving of pay in the eyes of market logic. And again, that is nothing short of a disgrace. We are in 2025, for God's sake. We also need to talk about fragmentation and inequality. Unlike the National Health Service, which is free at the point of use and universally accessible, social care in the UK is means tested. This creates a two-tier system where wealthier individuals can afford higher quality private care, while poor individuals are left dependent on overstretched and underfunded public provision. The current system forces people to deplete their life savings and assets to pay for care. Only when a person's savings drop below £23,250 in England do they become eligible for local authority support. This means that working class and middle class families face the prospect of losing their homes and financial security to cover basic care costs, while the wealthiest can shield their assets. And we should be ashamed. So how do we fix it? The only way to fix it, it's going to require a radical departure from the failed market-based model. We have to prioritise public ownership, universal access, and dignity for both care recipients and workers. We need to create a national care service. Social care has to be treated as a universal right and not a means-tested service or a market commodity. A publicly funded, publicly provided national care service modelled on the NHS would ensure that care is free at the point of use and accessible to everyone based on need. Yet, this is going to require significant public investment. But the long-term benefits? Improved health outcomes, reduced hospital admissions, and greater social equality. And they would far outweigh the costs. A national care service would create a unified system, eliminating the current postcode lottery and ending the financial barriers to care. We need to bring social care into public ownership. The profit motive is fundamentally incompatible with high quality social care. Care homes and dom care providers should be brought under public ownership, either through direct state control or through local authorities and cooperatives. Publicly owned care services would allow profits to be reinvested into improving care quality and working conditions, rather than being extracted to fill the pockets of the fat cats. Local authorities would then have greater control over standards, staffing levels and service delivery, leading to more accountable and responsive care provision. We also need to pay and protect care workers. Care work should be recognised as a skill and valuable labour. And why the hell isn't it already? Care workers should be paid a real living wage with proper contracts, paid travel time and pension rights. Staffing levels should be increased to reduce workloads and improve the quality of care. We're talking about people's lives. Unionisation in the care sector needs to be supported and it needs to be encouraged. And we need to ensure that care workers have a collective voice and the ability to negotiate better pay and working conditions. Providing proper training and career development opportunities would also help professionalise the sector and improve staff retention. We also need to get a shift on, because for years we've talked about an integrated health and social care service. We need to think about the separation between health and social care, which has led to inefficiencies and poor outcomes for patients. Many people end up trapped in hospitals because there is no social care support available and they can't be discharged safely. Integrated social care with the NHS under a single public framework would improve coordination, ensure continuity of care and reduce pressure on hospitals. We also need to fund social care through progressive taxation. And I don't care who that offends, and I don't care who that objects. We are talking about the most vulnerable people in society needing care and support. Because a national care service should be funded through progressive taxation, including higher taxes on wealth and corporations, rather than individually means testing people. This would ensure that the cost of care is shared fairly across society, with the wealthiest contributing the most. Ending tax breaks for private care providers and closing loopholes used by private equity firms would also provide additional revenue for the system. The crisis in UK social care is not an inevitable consequence. It's not a consequence of demographic change or economic pressure. It's the result of deliberate political choices. Decades of privatisation and austerity have created a system that is fragmented. It's unequal and it's unsustainable. Fixing social care requires a radical approach, public ownership, universal provision, fair pay for workers, and an end to the profit-driven model. A national care service would not only provide dignity and security, but would also reaffirm the principle that care is a collective social responsibility, not a commodity to be sold to the highest bidder. And until this changes, we should all be hanging our heads in shame.